Welcome to Evidence Mastery with Dr. Masood Tusi. I am going to help you understand what ADHD is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice.
All right, here's our roadmap for this explainer. We're going to start with the absolute basics, what ADHD is. Then we'll get into the causes, how symptoms look in kids versus adults, the nitty-gritty of diagnosis, the best treatment approaches backed by science, and finally, what it really means to live with ADHD long-term.
Okay, let's dive right in. First up, what is ADHD? Really, let's break down the fundamentals.
So, let's unpack this definition. The key phrase here is neurodevelopmental disorder. That's a really important distinction because it tells us this isn't about willpower or bad behavior. It's rooted in how the brain develops and functions. We're talking about a consistent, long-term pattern of inattention, hyperactivity, and impulsivity, one that shows up early in life and genuinely gets in the way of day-to-day functioning.
Now, ADHD is not a one-size-fits-all condition. The official guide that clinicians use, the DSM-5-TR, actually breaks it down into three main presentations. You've got the predominantly inattentive type, the predominantly hyperactive/impulsive type, and then the combined type, which, is a mix of both. Which one gets diagnosed really just depends on which set of symptoms stands out the most for that person.
And this is far from rare. The evidence suggests that a pretty significant chunk of kids, somewhere between 5 and 15%, are affected by ADHD. Now, you might hear that it's diagnosed about twice as often in boys. That's a really interesting point. There's a lot of discussion about whether that's a true difference or if it's because symptoms just show up differently in boys and girls, making it easier to spot in boys.
So that brings us to the big question, right? Why? If this is all happening in the brain, what are the causes? Let's take a look at what the science tells us about the risk factors.
Well, there's no single, simple answer, no one thing that causes ADHD. But what a huge amount of research points to is differences in the brain's wiring and chemistry. Specifically, it seems to involve two key chemical messengers, dopamine and noradrenaline. Think of dopamine as the reward and motivation chemical, and noradrenaline as the alertness and focus one. When these systems aren't working in the typical way, it can really affect our executive functions, the brain's management system that helps us plan, focus, and get things done.
So it's really a story of interaction. Genetics plays a huge role. ADHD definitely runs in families. But then, that genetic vulnerability can interact with other things. We're talking about factors like having a very low birth weight, certain exposures before birth, like to alcohol or tobacco, and even things like iron deficiency or significant early life stress. It's a complex puzzle of nature and nurture. Okay, let's talk about what ADHD actually looks like. And here's something that's absolutely crucial to understand. This isn't just a childhood condition that people grow out of. For about half the people diagnosed as kids, the symptoms change, for sure, but they definitely stick around well into adulthood.
And this is a perfect example of how those symptoms can change. Let's take hyperactivity. In a little kid, it's often exactly what you'd picture: running, climbing, just can't sit still. But in an adult, it often goes internal. It's less about climbing the furniture and more about this constant inner feeling of restlessness, like your motor is always running. It might look like fidgeting or just feeling like you have to be busy all the time.
And that internal experience has real-world consequences. For adults, the symptoms often show up as major challenges in daily life. Things like struggling to finish projects at work, difficulty with organization, feeling really impatient, or having big mood swings. As you can imagine, this can put a huge strain on relationships and careers.
So with all these different symptoms, how does a doctor actually figure out if someone has ADHD? Let's walk through how a diagnosis is officially made.
This is a really important point. There's no simple test for ADHD. You can't just do a blood test or a brain scan and get a yes or no answer. It's what we call a clinical diagnosis. That means it requires a thorough evaluation by a professional who pieces together all the evidence based on a very specific set of rules.
And those rules are there for a reason, to make sure we're diagnosing a genuine, persistent condition. The symptoms have to have been around for at least 6 months. They have to cause problems in more than one area of life, so not just at home, but also at school or with friends. They need to have started before age 12, and maybe most importantly, these symptoms have to be significant enough that they actually interfere with a person's ability to function day to day.
So, let's get specific. Here are the 9 official symptoms for the inattention side of things. To get that predominantly inattentive diagnosis, a person needs to show at least 6 of these,
consistently. And we're not talking about just losing your keys once in a while. We're talking about a pattern, like making constant careless mistakes, finding it almost impossible to stick with a task, or being so easily distracted that everything feels like a struggle.
And then on the flip side, here are the 9 symptoms for hyperactivity and impulsivity. Same deal. You need 6 or more for a diagnosis of that type. This is the stuff like constant fidgeting, blurting out answers before the question is even finished, or having a really hard time waiting your turn. And of course, if someone meets the criteria for both lists, at least 6 from each, that's when we call it the combined presentation.
Okay, so once a diagnosis is made, the next question is, what do we do about it? The evidence is really clear that the best approach is a multi-layered one, and it's not the same for everyone. It really depends on the person's age. The clinical guidelines suggest a pretty clear path. For the youngest kids, so preschool-aged, the first-line go-to treatment is behavioral therapy. Medication isn't the first step. But then for school-age kids and teens, the evidence shows that the most effective strategy is actually a combination of behavioral therapy plus medication.
When we talk about medication, there are 2 main categories. First, you have the stimulants. These are usually the first choice because for most people, they're highly effective at helping with focus and calming hyperactivity. Then you have the non-stimulants. They can also be very effective and are a great option, especially if someone can't tolerate stimulants for some reason. And obviously, like any medication, they both come with potential side effects that need to be carefully managed with a doctor.
And I really can't stress this enough. Medication is almost never the whole story. It's just one tool in the toolbox. Behavioral therapy is just as crucial. This involves things like counseling. CBT is a common one, but also very practical strategies like learning how to set goals, monitor yourself, and build structure and routines into your day. This is the foundation of good ADHD management.
All right, for our last section, let's look at the bigger picture. The prognosis. What does the future look like for someone living with ADHD? What does the evidence say about long-term outcomes?
Well, the evidence suggests that certain things can make the journey more challenging. For example, if ADHD co-occurs with other things like learning difficulties or significant social problems, the outcomes can be poor. This just highlights how important it is to have a treatment plan that doesn't just look at ADHD, but treats the whole person and all of their challenges.
So what does living with it long-term really look like? Well, that obvious outward hyperactivity we see in kids, that often does fade with age. But what's left behind? Those difficulties with focus, organization, and that internal restlessness often persists. This is why learning lifelong coping skills and having a solid support system is absolutely key for thriving in the long run.
I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.